The social side of emetophobia in children.
In the first meta-analysis of emetophobia, 11% feared only others vomiting, and another 39% feared both. So the social side is present in about half of cases. This isn't just about someone fearing that they're going to get sick. We're talking about a massive, often invisible fear of other people getting sick around them.
Section 1. Spotting the social subtype. Translating clinical definitions to the playground. Okay, let's dive into this
and see what this invisible subtype actually looks like when you're observing kids out on the playground. When a child has this specific social or contagion subtype, it literally translates into an intense dread of being vomited on. And because of that intense dread, these kids are constantly scanning their environment. They are hyper-vigilant. They'll look for any tiny signs of illness in their friends. They might flat out refuse to sit near certain classmates, or they might even try to skip school entirely if there's a rumor of a stomach bug going around. It looks like extreme behavioral avoidance from the outside, but to that child, it feels like an absolutely urgent survival mechanism.
Now take a look at this number, 10. Research shows that the mean onset age of emetophobia is right around 10 years old. So this is fundamentally a childhood onset fear. It's not usually something people just wake up with out of nowhere in adulthood. Nope, the roots really take hold right here in middle childhood. And here's another defining demographic reality for you, 91%. The pooled prevalence across global studies shows that emetophobia is overwhelmingly, profoundly more common in girls. So if you're a parent of a young girl and you're noticing these scanning and avoidance behaviors, well, this number validates exactly what you might be seeing at home. You are absolutely not alone in this.
Section 2. Disgust and contagion, the core driver behind the fear. Now, what's really interesting about this slide is
that it's absolutely crucial to understand we aren't just talking about pure anxiety here. A core mechanism of emetophobia is what researchers actually call disgust propensity. So what does that mean? It's basically a psychological tendency to be easily disgusted and then to react incredibly negatively to that feeling itself. And this is exactly why the contagion angle, just the thought of seeing or hearing someone else get sick, hits these kids so intensely. It's partly this massive disgust response, not just a fear response.
To practice extreme academic honesty here, research on emetophobia shows us this specific breakdown of social versus self-oriented fear in the broader, mostly adult population. Dedicated pediatric trials that isolate just this social subtype in kids are currently pretty limited. We're adapting broader clinical research for this explainer, but the data clearly proves that the fear of others, that social element, is a massive, load-bearing piece of the overall emetophobia puzzle.
Section 3. The avoidance trap. How the phobia is maintained.
So when your child is terrified, their natural instinct, and let's be real, yours as a parent too, is to just avoid the disgust trigger entirely. But that avoidance creates this terrible, vicious cycle. The origins often involve a traumatic early life experience, which then gets compounded by cognitive and social factors. Then come the safety behaviors. The child avoids sick classmates, or maybe they wash their hands obsessively. And then they enter these reassurance loops, constantly asking you things like, is anyone sick? Am I going to be okay? Now, providing that reassurance feels super comforting in the moment, right? But these safety behaviors and reassurance loops actually trap the child. They end up reinforcing the phobia over time instead of resolving it.
Section 4. What actually helps? Evidence-based approaches. So the crucial point is that the absolute cornerstone of treatment is exposure-based cognitive behavioral therapy, or CBT. It uses this graded, concurrent, step-by-step approach, and we really do mean step-by-step. A therapist might start step 1 with just having the child read words related to sickness. Step 2 gently moves to looking at a cartoon drawing. Step 3 might be an audio clip, and step 4, eventually, is watching a video of someone being sick. This whole process is heavily paired with disgust tolerance work, because the goal isn't just to reduce fear, it's about teaching the child's brain that they can safely tolerate that intense feeling of disgust without needing to run away.
And while multimodal CBT is definitely the gold standard, there are some emerging treatments that are incredibly exciting for this specific subtype. Virtual reality, or VR exposure, is being used as a safe, highly controlled way to simulate these exact social triggers. Imagine sitting in a virtual classroom where an avatar feels unwell. It literally allows the child to practice their coping skills in a perfectly controlled, simulated environment. Also, in some heavily impairing cases, SSRI medications are being used as an emerging adjunct to therapy, just to help lower that overall baseline of anxiety.
Section 5. Taking the next step, clinical guardrails. Now, if you're seeing your child's world shrink because of these avoidance behaviors, please listen to this clinical note. An intense, impairing fear of others vomiting can be genuinely disabling and absolutely warrants professional assessment. As we mentioned, this explainer adapts broader research to help you understand the mechanisms at play. But please, do not use it to diagnose your child yourself. You really want to seek out a professional who specializes in specific phobias and pediatric CBT to get a proper evaluation.
Fear Me Not helps kids conquer fears through play. But I want to leave you with this final thought. If the data tells us this crippling fear typically takes root right around age 10, how completely could we change a child's developmental trajectory, their social life, and their overall confidence if we knew exactly how to step in and tackle it the very moment it appears?